Good morning. Welcome to this COVID-19 briefing of the Ministry of Health, Wellness and New Health Investments. We acknowledge with us this morning the Minister for Health, Wellness and New Health Investments, Honorable Dr. Irvin McIntyre, the Minister for Tourism, International Transport and Maritime Initiatives, Honorable Dennis Charles, the Permanent Secretary in the Ministry of Health, Wellness and New Health Investments, Mrs. Leticia Lestrade-Wyke, the Permanent Secretary in the Ministry of Tourism, Ms. Lisa Valmond, the Coordinator, Health Promotion Unit, Mrs. Mignon Roll Shillingford, and those of you tuned in to this briefing, good morning. This morning, we will receive an update on our country's current COVID-19 situation and new travel protocols announced earlier this week. Our first presenter is Dr. Shaladdin Ahmed, and I now welcome him to address you. Dr. Ahmed.
Honorable Minister for Health, Wellness and New Health Investment, Honorable Dr. Irvin McIntyre, Honorable Ms. Dennis Charles, Minister of Tourism, International Transport and Maritime Initiatives, Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Leticia Lestrade-Wyke, Permanent Secretary in the Ministry of Tourism, International Transport and Maritime Initiatives, Ms. Lisa Valmond, Mrs. Mignon Shillingford, Coordinator Health Promotion, Mrs. Dion Smith, media and listeners. Good morning. It's my pleasure to present you with the COVID update. As of today, our active cases are 5. Total recovered cases are 192. And to date, there have been no deaths due to COVID-19. All our active cases are imported ones. They are all asymptomatic. So far, COVID transmission remains sporadic in Dominica. Our surveillance continues. I would like to remind our inbound passengers regarding our online screening. All passengers are required to upload and submit a valid negative PCR result. I emphasize negative PCR result, not antigen result. This is regardless of your vaccination status. If you are vaccinated, it's good for you. If you are not vaccinated, both groups are required to upload a negative PCR result. Antigen test result will not be accepted. I wish to share with you our lab surveillance data. So far, we have 19,612 PCR tests completed with a positivity rate of 1%. So this is to say we have very low transmission, because lower the rate, better you are in better situation. Concerning our vaccine campaign, to date, 19,138 people are fully vaccinated, and additional 1,300 are partially vaccinated. So far, 27% of our population are fully vaccinated. Our vaccine campaign continues. Thanks to primary care, they are available in every health district from Monday to Friday. You do not need to make an appointment, just walk in during the working hours for your vaccination. With this, I thank you and have a good day.
Our thanks to Dr. Ahmed for this update. As you heard from him, Dominica now stands at 5 active COVID-19 cases. On Monday, the Minister for Health, the Honorable Dr. Irvin McIntyre, announced new travel protocols for Dominica with implications for quarantine. These new protocols are expected to directly impact the tourism sector and the procedures at our various ports of entry. And so today we have with us the Minister for Tourism, International Transport and Maritime Initiatives, the Honorable Dennis Charles, to address you. Honorable Charles.
Good morning, everyone. Let me recognize the presence of the Minister of Health, Honorable Irvin McIntyre, the PS of the Ministry of Health, Leticia Lestrade, the PS in the Ministry of Tourism, Ms. Lisa Valmond, Dr. Ahmed, and to all the of you who are listening or viewing via television or on Facebook. The COVID-19 era has been really challenging for the tourism sector as we have constantly had to evolve and adapt to changing protocols since reopening our borders to facilitate safe travel. However, I believe that with the announcement of new protocols, especially for vaccinated travelers, who will no longer have to quarantine once medically cleared at the airport, we have reached a comfortable balance between tourism and health. We are in tune with the many persons whose livelihoods depend on tourism, and these new protocols will allow us to ease towards a full reopening and certainly make our visitors more relaxed and safe in our nature. The Safe in Nature Managed experience has been the main mechanism through which tourism has been able to survive and slowly rebound during this pandemic. But these advances have not been without challenges. So, to the many travelers who have faced difficulties in either obtaining an appointment or receiving their results on time, we sincerely apologize for any inconvenience. To our visitors, especially our first-time visitors to the Nature's Island, we have heard your concerns, and let me assure you that this is certainly not the normal Dominica hospitality experience. To the certified property owners, taxi drivers, and others who have had to face some of the backlash, we recognize and applaud your patience and tenacity in this industry. The Ministry of Health is aggressively working on resolving capacity constraints so that the availability of results will be more timely. I also want to remind the public that travelers whose destinations accept antigen test results can book appointments directly with the Lafayette lab. These new protocols aim to make it easier for vaccinated travelers to come to Dominica, as they only require one rapid antigen test on arrival and no quarantine. Importantly, the Ministry of Tourism has established our Customer Concierge Office and hotline for all queries, concerns, appointments, and results. So we now have a one-stop secretariat for all travelers' needs and concerns. From today at noon, visitors can call or WhatsApp 275-7298, 275-7298, and 275-7299, or drop us an email at daconcierge1@dominica.gov.dm to get answers and assistance from warm and hospitable staff who have expertise in hospitality and customer service. For tourism stakeholders, you can also contact Discover Dominica Authority Office for further information. Additionally, I wish to inform that Discover Dominica is preparing to launch an exciting new campaign, My Dominica's Bucket List and a Nature Islands Fitness Challenge. We continue to look for new air access opportunities which facilitate direct or one-stop routes to Dominica. And we share in the progress of our fellow island nations as they are able to progress from high risk classification to low risk, meaning no quarantine. Our two critical hubs for access to major source markets, Antigua and Barbados, have been able to do so in recent times, and we applaud their efforts in that regard. So Antigua and Barbados are now in the low risk category. Caribbean Airlines has recently announced direct flights to Trinidad to Dominica and resumption of the Dominica-Barbados-New York route from July 17th. Our protocols were also revised for yachties. Once vaccinated, they can enjoy the safe in nature experience, and once medically cleared, they can be granted coast-wise permission to move freely to other designated ports. Fully vaccinated seafarers can now wait only 30 minutes for antigen test results and be medically cleared after only 1 day. So my plea is that we all continue to encourage vaccination towards herd immunity. We hear of the emerging variants, but science also shows that vaccines can significantly reduce the spread of the variants and stop them from mutating. These new protocols are by no means an indication that we should lapse. We have to continue to insist on the general protocols which have become part of us. Wearing of masks in public spaces and hand sanitization. Strict adherence to protocols has ensured us the World Travel and Tourism Council's safe travel stamp, reinforcing that Dominica's health and safety protocols meet globally accepted standards. CDC categorization at level 1 rating, confirming Dominica as one of the destinations with the lowest risk for travelers. And of course, recently, we earned a well-deserved spot on the UK's green list for quarantine-free travel. So let's continue to be vigilant. May God continue to bless and protect our beautiful country.
Our thanks to Honorable Charles for her remarks, and we note that despite the new protocols, we heed the call for continued vaccination and adherence to strict safety protocols. I now invite the Minister for Health, Wellness and New Health Investments, the Honorable Dr. Irvin McIntyre, to address us on our continuing efforts to manage the COVID-19 pandemic and the recently announced adjustments to the protocols for vaccinated people traveling into Dominica.
Good morning to everyone. Let me first recognize the presence of the Honorable Minister for Tourism, International Transport and Maritime Initiatives, Honorable Dennis Charles. Let me also recognize the Permanent Secretary in the Ministry of Health, Mrs. Letitia Lestrade-Wyke. Let me also recognize the Permanent Secretary in the Ministry of Tourism, Ms. Lisa Valmont, our National Epidemiologist, Dr. Shalauddin Ahmed, and Mrs. Mignon Roll, Coordinator of Health Promotion. It is indeed my pleasure and duty to address you and update you again during this pandemic period. We are all aware of the social and economic struggles and difficulties the entire world is presently undergoing in view of the COVID-19 pandemic. And needless to say, more often than not, it is the developing countries who suffer the brunt of these unfortunate events. As a country, we have done well in managing the COVID-19 crisis so far. And this is largely due to the decisive leadership, our proactive approach, dedicated frontline workers, and engaged public adherence to protocols. We have always adopted a science-based management of the COVID-19 pandemic. However, we have been pragmatic as well, since different countries present different realities and solutions. The science has shown that fully vaccinated travelers, as well as individuals who have been previously infected with COVID-19, are less likely to be a source of transmission of the virus. This is even of greater significance in view of the emergence of the Delta variant, which is highly transmissible. With the increasing scientific data available, we continue to adjust travel protocols while still maintaining health and social measures. In all our deliberations and decisions, we have always and will always place the health of our people first. The adjustments made will alleviate some of the inconveniences faced during travel and will improve the travel experience for vaccinated travelers. This new change in protocols, coupled with our excellent management of the COVID-19 pandemic, is expected to boost travel to Dominica as one of the most preferred destinations in the region. The changes in protocols will take effect from Wednesday, July 7th, which is today, and are as follows. Protocols for pre-arrival. Compulsory requirement for all vaccinated passengers and travelers from high-risk countries will remain as follows. All travelers shall, 1, submit a health questionnaire online at least 24 hours prior to arrival in Dominica. 2, upload a negative PCR test from a swab taken within 24 to 72 hours prior to arrival. Number 3, upload vaccination certificate. Number 4, pay for antigen test online, which is EC $100, as well as for accompanying unvaccinated children. Travelers must present the following to the airlines or other travel carriers prior to boarding for travel to Dominica and upon disembarkation in Dominica. That is, a negative PCR test from a swab, as I said, 24 to 72 hours prior to arrival, and notification of health clearance to travel to Dominica. On disembarkation, travelers shall follow the standard health and sanitization protocols and present the following. Number 1, notification of health clearance to travel to Dominica. Number 2, negative PCR test results. Number 3, vaccination certification. Number 4, receipt from payment for antigen test. So these are the 4 things you present on disembarkation. Notification of the health clearance, a negative PCR, vaccination certificate, and your receipt for your antigen test. As regards to testing, someone who is fully vaccinated has presented their COVID-19 test, which is 24 to 72 hours prior to arrival, which is negative, then a rapid antigen test shall be administered to all fully vaccinated travelers on arrival. If the antigen test is positive, a PCR test will then be administered immediately to the traveler, and the traveler will await his results in room isolation at a government-operated facility or a safe-in-nature certified property. If the PCR test is positive, then the traveler will be admitted to the COVID-19 isolation unit until released by an authorized health professional. Hospital fees will apply. If the PCR test is negative, then the traveler will be deemed medically cleared and at the discretion of the medical officials. However, if the antigen test is negative and the traveler has been vaccinated and the traveler has a negative PCR prior to travel, the traveler will be deemed medically cleared at the discretion of the medical officials, and there shall be no mandatory quarantine for fully vaccinated travelers who have been medically cleared. Travelers shall also self-monitor, record temperatures daily, and report any symptoms to health professionals. So let me just repeat the testing. If you're fully vaccinated, if you have presented a negative PCR prior to arrival, which is taken 24 to 72 hours prior to arrival, at the airport, a rapid antigen test will be done. If it is negative, you're deemed medically cleared. If it is positive, then a PCR test will be done. If the PCR test is positive, you'll be admitted to the COVID isolation unit. If the PCR test is negative, then you are deemed medically cleared. But the public should be aware that when we talk about fully vaccinated travelers, it means they have completed both doses of an approved COVID-19 vaccine. The approved COVID-19 vaccines are Pfizer, Moderna, Sinopharm, AstraZeneca, and Johnson & Johnson. In the case of the Johnson & Johnson, it's 1 dose that makes you fully vaccinated. And in the case of the other 4, it's 2 doses. The vaccine has to be approved by the Ministry of Health, CAFA, and the World Health Organization. And all the 5 vaccines I mentioned have been approved and they have gotten EUL listing, that's emergency use listing from the WHO. The second dose of the vaccine must be done at least 2 weeks before arrival in Dominica. In the case of the Johnson & Johnson, which is a single dose vaccine, 2 weeks after that single dose. So let me just reiterate, someone to be fully vaccinated, to be considered to be fully vaccinated, you must receive 2 doses of an approved COVID-19 vaccine, or in the case of Johnson & Johnson, a single dose. This also must be at least 2 weeks prior to arrival in Dominica. And the vaccines that we recognize are those from the WHO that have been approved by WHO, by CAFA, by the Ministry of Health, and this would be the Sinopharm, AstraZeneca, Pfizer, Moderna, and the Johnson & Johnson. I take this opportunity to announce our low-risk countries as follows. That is Antigua and Barbados, which were just brought, they were previously in the high-risk countries, but now they're in the low-risk countries. Apart from Antigua and Barbados, in the low-risk, we also have Grenada. All the other regions I'm going to mention in the Caribbean are high risk. That is, Anguilla remains high risk. The British Virgin Islands have been brought up to high risk. Haiti remains high risk. Jamaica remains high risk. St. Kitts and Nevis remains high risk. St. Lucia remains high risk. St. Vincent and the Grenadines remain high risk. Trinidad and Tobago remain high risk. Turks and Caicos is also high risk, and Guyana remains as high risk. So the 3 countries in the region which are low risk, Antigua and Barbados, and Grenada. All travelers from low-risk countries do not require mandatory quarantine, but must have a valid PCR done 24 to 72 hours prior to arrival. Travelers will receive an antigen test on arrival and medically cleared if the test is negative. So all travelers from low-risk countries do not require mandatory quarantine, but must have a valid PCR done 24 to 72 hours prior to arrival. And these travelers will receive an antigen test on arrival and be medically cleared if the test is negative. Let me take this opportunity to also remind everyone that it is important to get vaccinated. It is also very important to note that 99.5% of all deaths due to COVID-19 in the last 6 months have been in unvaccinated patients. So let me repeat, 99% of all deaths related to COVID-19 are in unvaccinated individuals. Getting vaccinated is our defense against COVID-19 and our key to reopening our economy and also regaining and growing our livelihoods. This is also the only way we can get back to social and sporting activities which we all look forward to. It is also important to show a sense of public concern and continue to adhere to the basic protocols of hand washing, sanitizing of frequently touched surfaces, wearing of our mask, and physical distancing. These basic simple measures must continue because we know that the COVID-19 pandemic is not over and will remain with us for at least another year. We are also pleading to all travelers and visitors to adhere to the protocols. It is because of these protocols we have been able to keep our numbers down, prevent community spread, and keep our people safe. I thank the general public for your cooperation thus far, for participating in our vaccination efforts and adhering to our public health and social measures. It is with this collective and collaborative action we will all continue to effectively fight this dreaded pandemic. The government has made the vaccines available, and your vaccines are at the health centers waiting on you, the public. We are urging you to please visit the health centers for your vaccines. We understand the skepticism related to vaccines, caused largely by misinformation on social media, but you must trust the science. The question related to how quick the vaccines were developed can be explained. We've seen SARS, that is severe acute respiratory syndrome, We've seen MERS, that is Middle East Respiratory Syndrome. These are all caused by coronavirus. So we knew that the coronavirus had pandemic potential. And that is why the technologies have been in development over the past few years. So when COVID-19 came, the technologies were there, the preparations were there. It was just a matter of sequencing and getting the vaccines done. So that is exactly why the vaccines were developed in such a quick period of time. Also, the question regarding side effects can be explained. Side effects, as a matter of fact, 95% of all side effects or all adverse effects to vaccine show up in the first 2 months. We're well in a year of vaccination. So that should give you some comfort as regards to the side effects that we've been mentioning over and over. I wish also to thank all our healthcare and other frontline workers for their continued dedication to the fight against COVID-19. And I am pleading to the public to assist us with illegal entrance into Dominica. This is one of our major threats. It only takes one person to escape into the community and we are back to square one. So you won't be selling out, you won't be a snitch, be actually being a patriot and saving the country from community spread. I thank you very much.
Our thanks to the Honorable Minister for Health, Wellness and New Health Investments, Dr. Irvin McIntyre, for his comprehensive remarks. And this takes us to the end of today's briefings. As you have heard from the health officials and from Honorable Charles, even with the adjustments made to allow for freer entry into the country, we still have a responsibility to ourselves, our families, and our communities to maintain all safety protocols. The health of the nation remains of paramount importance. The considerations include the consistent wearing of masks, sanitizing of hands, cleaning of surfaces, adherence to safe respiratory practices, and as much as possible, the observance of physical distancing. Please be mindful that the mandatory mask mandate remains in effect for Dominica. We thank you so much for joining us this morning. Do stay safe and have a good day.